All right, so this is, as most of you know, this has been a series of symposia that's a partnership between GW and ICF. And to close this session, it's my pleasure to introduce to you Sudhakar Kesavan, who's chairman and CEO of ICF International. I'm going to move up to the podium here to welcome him to it. Since he took on this leadership role, he has led ICF through a leveraged buyout and an IPO. That's kind of an unusual experience. He was named Tech Titan and Industry Leader by Washingtonian Magazine in 2013. In 2009, he was recognized by the Professional Services Council, Fairfax County Chamber of Commerce's Greater Washington GovCon Council, and Washington Technology Magazine as Executive of the Year. He is a board member emeritus of the Rainforest Alliance, a New York-based nonprofit environmental organization that protects the ecosystems. In addition, he is an active supporter of Impact, a nonprofit focused on primary education for girls from economically and socially underprivileged rural areas of India. This, by the way, is a great interest of many of my faculty. Mr. Kesavan has a bachelor's degree in chemical engineering from the Indian Institute of Technology, a postgraduate diploma in management from the Indian Institute of Management, and an MS from the Technology and Policy Program at the Massachusetts Institute of Technology. Welcome.
Thank you very much, Dean Goldman. I want to thank all of you for attending today's session. I also want to offer my thanks to President Knapp, Dean Ackman, Dr. Croyle, Dr. Sotomayor, for taking the time and for being here and helping us continue the high-quality programming which we have been able to achieve in this series. I was reminded, talking about interdisciplinary research, that I went to the Technology and Policy Program, as Lynn said, at MIT, and this was many, many years ago, in the early 80s. And every time we wandered around talking to the basic scientists or the engineering school, they all wondered how we got in to MIT, because it was supposed to be an institution for pure sciences or for pure engineering. And therefore, interdisciplinary research was not quite the thing there. But obviously, the dean there had recognized the fact that something has to be done about public policy and technology. And I think that was a program which had just been started and, in fact, has prospered since. And now there is a whole Institute for Data Systems Analysis, which has been set up to help further the whole systems engineering and data analytic programming at MIT, so that we can put all these disciplines together. So it really is a terrific thing to hear that there is more respect for interdisciplinary research now than there was perhaps 30 years ago. I think we at ICF, if you're not aware, believe that the work we do does help the world a sort of a better place. We do this work in many diverse areas, including energy efficiency, climate change, human trafficking, and of course health. Specifically, as our work relates to cancer, we support the National Program of Cancer Registry's cancer surveillance system. We have helped to redesign the cancer.org website for the American Cancer Society, and we contribute to important research on the Smoke-Free Program, the Health Information National Trend Survey, and many other cancer-related research programs. I work with the Department of Health and Human Services and the National Cancer Institute to help people stop smoking, and in recent years we've received awards from the North American Association of Cancer Registries and from the National Institutes for Health for our work supporting efforts to combat cancer. We are proud of the work we do to address cancer. Perhaps it's the personal contact, though, with the disease, that hits us usually very close to home. It is difficult to find anyone, anywhere, who has not been touched directly or indirectly by cancer. We know the statistics all too well. Roughly 1 million people are diagnosed with some form of cancer each year in the United States, and nearly 600,000 die from its ravages. Cancer also imposes enormous direct and indirect costs, from an estimated $90 billion cost burden per year in direct medical treatment costs to obviously the less quantifiable emotional costs associated with the diagnosis, treatment, survivorship, and end-of-life care. Few, if any, health topics are more deserving of our attention, and that is why we are teaming with GW to bring this series to you. Let me end by offering my congratulations to everyone who participated and attended today's event to help improve lives of those with cancer, and for dedicating so much time and effort to this cause. Thank you very much, and have a very pleasant afternoon.